I think as equestrians, we're so taught to power through. We're so taught like to ignore maybe if things don't feel right, like just keep going, just work through it. And I think that like sometimes there's merit to that, but like sometimes there's not. Like we think about Simone Biles at the Olympics, and she didn't compete because she knew it was unsafe and she was protecting herself. And I also think there's a lot of merit in that and kind of saying like, this is what is safe, this is what is right. I also think that when you're entering into parenthood, motherhood, um, the time off from riding is just the first of so many sacrifices you're going to be making for this child.
Hi, Claire. I'm so excited to talk to you today.
Thank you. I'm excited about this.
Yeah. Yeah. So if you're okay with kind of just starting with like, you're such an interesting person to chat with because you are like all of the things professionally and like in your personal life that is so interesting to me. So we'll get into at some point kind of your professional side and your professional perspective on this, but I'd love if you could start with kind of talking a little bit about who you are as a horsewoman, maybe like pre-kids, um, and kind of jump in there.
Yeah, I've ridden since I was 7 or 8 years old. I've always shown hunters, except for a few years when I showed jumpers. I did, the junior hunters big X when I was a junior. Then I went to college, switched to jumpers for a while. I now own a horse named Pluto, and we do the adult amateurs. Um, yeah, so that's kind of the horse situation.
And you have a podcast as well.
Yes, I do a podcast with three of my friends called Amateur Hour and Equestrian Podcast, which is really us. It's basically meant to feel like you're just sitting around the tack room chatting with your friends. And we talk about things that are important to the industry, things that are happening, but we also just kind of chat about our horses and chat about our lives. And it's just it's just for fun. It's just like a fun thing just to it really started as just a way for us to video chat with each other regularly. And then we decided to put it out there.
Yeah, fun. I kind of think of that as like also horse person side of you in my mind.
Yeah.
I don't know. That's just I guess how my brain works. But
I th
and
I
then
think I
sorry,
think
go
when you're a
ahead.
horse, I think when you're a horse person, it permeates kind of all areas of your life. Like I find that even, I play tennis and my best tennis friend is also a horse person. And like I find that in all the little areas of my life, the people I end up spending time with and becoming friends with people who are horse people, even if we never did the horses together. I don't know. I have a friend who's moving to a new state and she just did a hour-long call with a parent at her kid's new school and it also a horse person. So I don't know, it's kind of a little community.
Yeah, absolutely. I think yeah, we have I feel like just a really different perspective on kind of everyday things sometimes. So it's helpful to kind of have someone else that sees things the same way.
Yeah, absolutely.
And then you're also a mom. Um, could you tell us a little bit about that? And also maybe did that change your horse life at all, or did that kind of fit into your horse life?
Yeah, I have a 7-year-old daughter and she's the absolute best. When she was really little, it really it did not change my riding life very much at all. I had a great community. I mean, you have to if you want to ride and be a mom. Um, So I had people to watch her. I would have her come to the barn with me and have people watch her at the barn, at home. And I was really very fortunate that I have so many very supportive people in my life. But now, and so then I actually, we made it through her toddler years. I was getting to ride a ton, and I was like, wow, like I really integrated this into my life so well. And now, then she turned 6, 7, and now she has all these interests and activities, and she wants to go places and spend money on things. And actually now is when it's more difficult to juggle everything. When she was little, when she was just a tiny little baby, I really was able to integrate it pretty well. But now that she's 7, and she has tennis, she has karate, she has play dates, she has clubs and friends and activities, it gets so hard just to juggle everything and keep all the balls in the air.
Yeah. Does she ride? have any interest in horses or not so much?
No, she did some lessons when she was younger, and she just told me, like, I don't ride. And I said,
Mm,
that is fine because it is really expensive and really dangerous, and we really can't afford two horses anyway. So I
there you
was
go.
I was okay with that. She has her other interests.
Perfect.
Yeah.
Yeah. Yeah, I right now my baby's only where are we now? 9 months old. And I definitely like when she was first born and like so tiny, it was a little more challenging than it is right now just because like I couldn't like set her down necessarily and like not just anyone could watch her. But now she's like so social and we have all these teenagers at the barn and they just come like hang out with her at my tack room and I'm able to like go disappear for an hour and ride a horse and then come back. And I'm like, oh, okay, this is where it's starting to make sense how like this is starting to feel a little bit easier. But I could definitely see like down the road, as she continues to like separate herself and become her own person, how that could be a challenge. Um, I did already get her a pony for when she's ready, if she's ready, because I have a lesson program too. And like this perfect little mini horse came up that's like, trained and well behaved somehow. I don't know. And I was like, I guess that the opportunity presents itself. So I'm using the pony for lessons. So no pressure if she's not interested in riding, but I'm hoping that she'll be interested enough that at least she'll be entertained at the barn when I'm there. I don't know.
Yeah, and honestly, I think because I got her on horses and ponies when she was so little, like we'll go to the barn with her friend and she can get on and do a trail ride. And she can
Mm,
like get on and sort of like bum around with her friend, kind of, trot around or, we did like when it snowed here, we did a trail ride in the snow and they were bareback. And she was able to tolerate that, and like had fun. So I think it's just, I like that she had the option. It sounds like your daughter will have the option, and if she chooses not to, it sounds like you have a really cool pony now.
yeah, totally. So fun. Yeah. So then I also am curious about. So you also are an occupational therapist, is that right?
Yeah, so I'm a pediatric occupational therapist also. So I work with children. Actually, when I went into OT, I had planned to transition to hippotherapy, and
Very cool.
I just haven't, I just haven't had a chance. I do hope that's something I'm able to do in the future. But yeah, so I work with children with all sorts of different needs, different difficulties, and functional deficits, and we work to remediate them or come up with environmental modifications. So it's a great job. I really enjoy it.
Yeah, so I have so many questions about this, because I feel like when I first got pregnant, it was like there wasn't a lot of information, like real information about what's safe, what's not safe in respect to horses specifically. Like it felt like it was either like, oh, trust your body, you'll know when you're done, which is hard for me because I'm like a planner and like I want to know like step by
Yeah.
step what to expect. Or it was just like absolutely not. Don't take the risk. Don't eat. Like I had an aunt call me lovingly, but she doesn't know anything about horses and was just like, "You're not going to the barn anymore, right? Like you can't even be around them." And I was like 6 weeks pregnant and I was like, my life can't just change like that. Like I have this responsibility too. So anyway, it feels like there's like I had a lot of question marks and it was hard to like find answers. So I'm curious if you have answers about that, like what is safe, what's not safe for pregnant people, and then I also am curious about kids after that.
Yeah. Well, when I got pregnant, my doctor was like, stop immediately. And I did. Um, and that was just my choice. I actually wrote an article for the Pod Horse about this, and I interviewed an high risk OB-GYN. And he said, kind of the same thing, stop immediately. And he said, if you won't, if you can't or won't, like you should really stop after the first trimester,
Mhm.
just because your body's going through a lot of changes. There's a lot going on. The risk is huge. That being said, that's kind of for, I think, I think of it's probably different for amateurs and professionals, right? Like if you're making your money that way, it's going to be different, but it's just the risk, there is risk. Um, I think as equestrians, we're so taught to power through. We're so taught like to ignore maybe if things don't feel right, like just keep going, just work through it. And I think that like sometimes there's merit to that, but like sometimes there's not. Like we think about Simone Biles at the Olympics, and she didn't compete because she knew it was unsafe and she was protecting herself. And I also think there's a lot of merit in that and kind of saying like, this is what is safe, this is what is right. So I mean, I think that it's hard to find a definitive answer because it is kind of a difficult situation. You do have to trust your body. Um, that being said, I also think that when you're entering into parenthood, motherhood, um, the time off from riding is just the first of so many sacrifices you're going to be making for this child. Like, I think that every day I make decisions for my child, and I'm happy to. And like, I'm, it's the choice I want to make, and I'm so happy about it. And this is just one more. This is just maybe the first one that you're going to make. Um, so I don't tell people what to do. Uh, I tell people what I did, and I tell people what the like OBs I've talked to have said. But it's every woman's body, every woman's pregnancy, every woman's decision. I would never tell somebody else what to do. Um, I just hope that people are cautious and careful and thoughtful. And if it's not feeling right, you know, I hope that they will make a choice to keep themselves and the baby safe. But
Mhm.
absolutely, they need to do what feels right to them and their body and their situation.
Mhm. And what about even like, I don't know if you have thoughts about this specifically, but I also just think about all of the kind of tasks that go along with horses also being potentially dangerous in pregnancy. Like I think about diastasis recti damage and even like lifting heavy things, like, we like lift a bag of feed here and there or whatever. And like, that also is something that it seems like there's really varying advice out there. Like, I don't know if you can speak at all to that idea of kind of um I don't know, how do you know what's safe to keep doing around the barn?
Yeah, I mean, I would say that women should speak to their physician about that. Absolutely. Like,
Mhm.
I know so many women who were put on lifting precautions. They weren't supposed to lift anything that was heavier than 25 pounds. The problem with that is that, especially horse people, 25 pounds is nothing. Like, I will sometimes lift 25 pounds, something that's large at 25 pounds, and you're like, this is nothing, right? So I could see myself easily lifting something that's 40, 50 pounds and being like, this is probably 25 pounds. Um, and so I do think it's just, again, be honest with your physician and be honest with yourself about how your body's feeling. This was not even at the barn, but I worked with a pregnant OT, and she was doing a transfer for one of our patients, and they had not said, they had not given like a very appropriate transfer level for him. So he was actually like max assist transfer, and they had said he was mod or something like that. Anyway, she helped lift him. It was it was too much. It was too taxing on her body. She hemorrhaged. The baby was fine. She ended up being okay, but luckily we were in a hospital. She just went down to her OB's office right away, and everything was fine in the end. But just, I think that sometimes it's so hard to understand, like when we're in a situation or when we're getting into a situation, how our bodies are going to handle it. So it is important just to be like cautious, talk to your doctor.
Mhm. Yeah, that makes a lot of sense. Yeah, I think that like talk to your doctor piece is so important, and like also can still be so challenging because a lot of doctors don't necessarily understand horses also. Like I just went to my doctor like this week because I got kicked in the hip from a yearling like 4 years ago, and it
Ooh,
still is kind of bugging me off and on now and then. And so I finally was like, I'm gonna talk to my doctor about this when I'm there. And he was like, whatever, asking me all these questions. He was like, "Any back pain?" And I was like, "Well, not normally, but I did fall off a horse like a week ago, so I'm having a little bit of back pain, but like it just kind of comes with the territory." And he was like, "Why do you do this? Like, why? What drives you to do this?" But anyway, like those are literally like the only two injuries I've had from horses in the last, I don't know, 10 years is like the kick and the fall. But like that happens, and
right.
um it seems like maybe not all healthcare providers are aware of either necessarily the horse risk or maybe on the other end, um, like just what all is entailed in horse care and management. So Yeah, interesting just to like kind of have the conversation with a healthcare professional. Um,
I think when you're around horses, pregnant or not, like we are all, I hope everyone is kind of very aware that accidents happen. These are huge flight creatures, right? I mean, like these are huge fight or flight creatures. So like even when I'm tacking up, I usually have my helmet on. And I trust my horse. I've had him for almost 10 years. He's the greatest guy, but he's still programmed to overreact, right? And so I think pregnant or not, like it is important just to be careful. And kind of when you were describing like 4 years ago, you got kicked and you just mentioned it now to your doctor.
totally.
That's such an equestrian thing to do. And that's like, I think when you're pregnant, especially like, I just wish I do it too. This is such like a do as I say, not as I do, because I'm like the biggest, like, tough it out. Don't mention it. Just go on. Like I'm the one who goes into the barn when I'm sick and powers through. And then my friend has the sniffles and I'm like, take care of yourself. But like, but I do think that like as a group, I wish that maybe we would do that a little bit less. Like just just tough it out a little bit less.
I
A
think
little bit.
especially in pregnancy too, right? Because it's not
Yeah.
just you that you're toughing it out for, it's also your baby. So there's like that added layer of like your choices directly impact a whole other person now, you know.
Yeah. Yeah. And I think it's hard. It's hard because so often things go right. And so it's hard to be cautious enough for when things go wrong. I think
Mhm.
um because if most of the time I go out to the barn and everything's totally fine, it's hard then to plan like, to be to use all the precautions you need for that time when maybe things don't go quite so well.
Mhm. Yeah, absolutely. Yeah, it's like kind of like expect the best but prepare for the worst. Is that the saying? Something like that?
Is it hope for the best, prepare for the worst?
Yeah, that one.
Yeah.
Yeah, yeah. Yeah. Okay, so then the next question I have is about kids and babies. So it is amazing to me. Again, just people that like don't necessarily know horses that well, but like family members and stuff that are like, so how many horses has the baby been on? And I'm like, none, because no helmets fit her little tiny head. Um, but I am curious. I have a kids riding program too, and I usually start them around 3 years old on the lead line with mom or dad right next to them, whatever. But I'm curious if you have any thoughts about like how old is old enough to ride? How do we know, like, are there developmental markers we could look for? Um, kind of that vein.
Yeah, I mean, I think a PT would probably have more thoughts about, like hip and and like spine and all of that.
Mhm.
Probably a PT would have a lot more thoughts about that. For me, I think that if you're being very safe, if you're making sure that you're not pushing it too hard, then it's actually probably pretty good for their bodies to get all of that like great input. But I will say that one of my biggest pet peeves, please don't put your kid on a horse without a helmet on. Even for a picture, even for just a moment, just if your kid is on a horse, just put a helmet on. It like it worries me. Just I guess that's my contribution is like helmets, please protect your head. They're
Yeah.
important.
Yeah, for sure. Yeah, and then I'm also curious about, um, like, so I have a student that the mom said that their occupational therapist sent them to me for riding lessons because, um, I guess so I don't totally understand this, so, like, maybe you can jump in about something here, but,
Yeah.
essentially because she walked before she crawled, which I don't even know if that's a real thing or that's a myth, so that's one question, I guess, is that really important to crawl first and then walk? Um, that somehow the movement of a horse would simulate that in the kid's brain and help kind of
Mhm.
rewire those connections that maybe were missed early on. I don't know. That's a very vague question, but like, is there any merit to that? Is that, I don't know,
Yeah,
helpful?
so I don't do hippotherapy yet, but yes, with the Back to Sleep campaign, one thing that happened was that babies are not crawling as much, they're not crawling as early, and their crawling is really important for develop. And I'm not saying do not put your babies on their back to sleep. Please, back to sleep, yes. Um, but crawling is important for your core strength and it's important for developing the muscles in your hands. Um, the way that a horse walks is said to mimic that sort of walking motion for humans and can help with the feel and the development and the neurological connections for walking. So I have told many, many, many patients to go do riding lessons, do therapeutic riding, do hippotherapy, because it is such a great therapeutic tool. So yeah, absolutely. That's great. I love that. I love that that OT sent the child to you.
Yeah, it was just a really interesting, I don't know, super interesting thing. And then my baby has like since day one shown more interest in like pulling up and standing or whatever than in crawling. And I was just like, with that happen, when that happened, I was like, oh my gosh, I should really make sure that we do lots of tummy time and really try to help her crawl. And she finally is crawling and not walking yet, which is great. But I just like, I don't know, I just it made that feel really real for some reason to like see a kid that went through that and then, in the aftermath of that and also my baby showing this like inclination to do kind of the same.
Yeah. As a pediatric OT, stuff like that happens to me a lot. Other pediatric OT moms and I will joke about how we see too many red flags, right? Like I remember taking my daughter to the doctor, to her pediatrician when she was very little, 18 months, 2 years old, probably 2 years old. And I said to the doctor, and I was like, I keep seeing her toe walk. And the doctor was like, nope, she is just tiptoeing. Like it is okay. It does not, but when you're an OT, you see this stuff all the time and you get kind of a little bit hyper aware of it.
Like everything's a symptom.
Yeah, you just think everything's like you know, everything's meaningful, but it's not everything's meaningful.
I guess it could be the other way though too, right? Like it could be I don't know, like you because you see it all the time, you kind of become numb to it. So it's probably better to see too much.
Um, I don't know any OTs who become numb to things. Most of us just, yeah, we're able to see warning signs, maybe too many warning signs way too
Mhm.
easily. I will say that I used to joke that I did less like sensory and OT type stuff with my kid than probably any other parent in the country because I would come home and I'd be like, oh, not more of this. Um, but that being said, her fine motor skills are great, great handwriting, so it all
Perfect.
worked out in the end.
Awesome. Cool. Well, if you have any like kind of advice or words of wisdom for people, either like moms trying to balance horses and baby and work or, making these decisions, important decisions about their safety around horses or anything like that.
Yeah. Oh man. I think that trying to find that horse mom work balance is one of the hardest things. And the only advice I have is to have, as I mentioned earlier, support, have good help, have good people in your life. Um, because if you have somebody to watch your kid, it makes it a lot easier, especially if someone they love and trust. And if it's fun for them, it makes it that much better for you. So I hope all the mom equestrians out there are able to rely on people to help them because that's the only way I think that you can make it work. That or hire a nanny or an au pair or a babysitter.
I kind of feel like that's almost like the hired village though, right? Like if you
Yeah.
don't have them immediately there for you, then you can kind of hire somebody to take that role.
I mean, absolutely, right. Yeah, it is that hired village, but you gotta do what you gotta do.
Totally. Absolutely. Awesome. Yeah, well, thank you so much. This was like so helpful. I feel like I got a lot of my own questions answered. I'm hoping other people will get their questions answered. If you want to kind of mention where people can find you or find more information.
Yeah, so probably the easiest place to find me, and I have to look because I am absolutely going to forget what my username is. Probably the easiest way to find me is on Instagram, and my Instagram handle that I should know because I've had it for is Claire.a.Taylor. So Claire.a.Taylor. And I'm very friendly. If people want to like chat, I will almost always respond.
Awesome. And I'll make sure to put a link too so that that's easy for people.
Excellent. And the podcast is Amateur Hour. If people want to listen, it's just a good time. It's just fun. It's just chatting. It's not meant to, you know, I don't know. It's just for fun, you guys.
Awesome. Cool. Well, thank you so much.
Yeah, thanks for having me. This was fun.